Hi, welcome to Future Nurses YouTube channel. So please subscribe and support our YouTube channel. So let's start today's video. First question: when making an occupied bed, the nurse aide should option: put the dirty sheets on the floor, help the client to sit in a chair while the bed is being made, lower both side rails before changing the sheets, raise side rail on unattended side. So the correct option is option D. You need to write. You need to raise the side rails. Okay. So next question. The nurse aide is in the employee dining room. A group of nurse aides are eating lunch together and begin discussing how rude a certain client was acting. The nurse aide should option join in the conversation, suggest that this is not the place to discuss the client, be quiet and not say anything to the other nurses, return to the unit and tell the client what was said. So the correct option suggests that this is not the place to discuss about the client. Option B. So next, the nurse said enters a client's room and the client states that he has pain. What should the nurse aide do? Options: report it to the nurse in charge, tell the client to get out of bed for a while, tell the client that the pain will go away soon, ignore the client's statement. So, the correct option for this question is option A: report it to the nurse in charge. So, next, a client is upset and crying over the recent death of her husband. How should the nurse aide respond? Options: tell her not to cry because it will make her feel sad. Close the door and leave the client to cry alone. Take the client to an activity to help her forget her husband's. Sit with the client and allow her to talk about her feelings. So option D is the right answer. So next, which temperature is considered most accurate? So options: oral, axillary, groin, and rectal. So the most accurate temperature is will find in rectal. So option D. Next, what is a beginning sign of pressure sore? So the options are swelling, numbness, discoloration, coolness. So the beginning sign of pressure sore is discoloration. Option C. So next, while assisting a client with denture care, the nurse aide observes that the upper plate is cracked. The nurse aide should option clean the dentures and return them to the client's mouth, call the client's family, call the dentist and make an appointment, report the damage to the nurse in charge. So option D is the correct answer. You need to report the damage to the nurse in charge. So next, a new client refuses to wear a clothing protector at lunch. The nurse aide should tell the client that he must wear it, put the clothing protector on the client, report this to the nurse in charge, respect the client's wishes. So option D is the right answer. So next, the nurse aide can best show that he is listening to the client by option changing the subject frequently, responding when appropriate, correcting the client's mistakes, directing the conversation. So option B, responding when appropriate. Next, the best time to prepare for a disaster is options: while evacuating residents, during lunch, when everyone is safely in bed, before it happens. The best time to prepare for a disaster is before it happens. Option D. So next, mode of transmission of pertussis. Options: vector transmission, through contaminated water, droplet infection, fecal oral route. So the option is Mode of transmission for pertussis is droplet infections. Option C. So next, time required to measure the Montauk's test. So options 24 to 48 hours, 48 to 72 hours, 10 to 12 hours, 2 to 4 hours. The time required to measure the Montauk's test is 48 to 72 hours. Option B. So next, name of the oral polio vaccine. Option BCG, TAB, SAG and Sabin. So the correct option, the oral polio vaccine is Sabin. So next, the following are the standard tuberculosis drugs except option chloromycin, streptomycin, INH and PS. So the correct option is chloromycin, which is not included in the standard tuberculosis treatment. So next, combination of triple antigen. Option DPT, BCG, TAB and ECG. So the correct option is DPT. The combination of triple antigen is DPT. Next, the time interval between infection of suspected person and the appearance of signs and symptoms of the disease is called. So the time between suspected person infection and the appearance of signs and symptoms. Options quarantine, recovery period, incubation, isolation period. So correct answer is incubation. Next, route of transmission of hepatitis B is options oral, potential, fecal-oral, contaminated water. So the route of transmission of hepatitis B is called potential. So next, mode of transmission of typhoid fever is most common questions. Okay, so options intravenous, IV, orophycal, respiratory and droplet. So the mode of transmission of typhoid fever is fecal oral route. Option B. Next, causative organism of diphtheria is options mycobacteria, streptococcus, corynebacterium diphtheriae, staphylococcus. So the answer is C, corynebacterium diphtheriae. So next and final question, incubation period of measles is 1 to 7 days, 7 to 14, 14 to 21, 21 to 28. The incubation period of measles is 7 to 14 days. Option B. So friends, we have came to the end of the video. So please subscribe and support our Future Nurse YouTube channel for your upcoming AIIMS NORCET and nursing officer exams. So thank you.